Hi, I'm Cristina Gordo, a professor at Universitat Oberta de Catalunya, UOC, and associated researcher from the Barcelona Institute of Global Health, IS Global. I want to present you the initial results of a study, a study I lead in which we aim to explore whether exposure to heat stress is a risk factor for renal damage among agricultural workers in Spain. Specifically, the objectives of the study are: first, estimate the incidence of AKI over the course of a single work shift. Second, compare the levels of biomarkers of renal damage and function before and after the work shift, specifically levels of NGAL and levels of cystatin C. And third, study the association between heat stress and the incidence of AKI and changes on these biomarkers of renal function before and after the work shift. To do this, between 2018 and 2019, we enrolled male agricultural workers from working during 2 different seasons and into different provinces. We enrolled 43 workers in summer in the province of Alacant and 52 workers in winter in the province of Tarragona. For all participants, we collected information on sociodemographic, clinical and occupational factors through interviews, and we also collected urinary and blood samples before and after the work shift. Also, we measured the wet bulb glove temperature, so WBGT, in the working place. For each participant, we estimated exposure to heat stress during the work shift based on the WBGT index. We estimated the cross-shift incidence of AKI, and we compared the levels of NGAL and cystatin C before and after the work shift. We used regression models to assess whether heat stress was a risk factor for AKI and increase in NGAL and cystatin C levels. Well, according to the results of our study, the mean WBGT was 24.5 Celsius degrees during the summer season and 14.2 Celsius degrees during the winter season. Our results indicate that 21% of workers harvesting during summer months were exposed to heat stress. Incidence of AKI was higher during summer season, being 33%, than during the winter season, being during that season 4%. Well, according to the results of the regression models, we can confirm that heat stress was associated with cross-shift incidence of AKI. However, heat stress was not associated with increased levels of NGAL or cystatin C levels over the course of a work shift. Based on that, we can conclude that heat stress is a risk factor for AKI among agricultural workers in Spain, even when environmental temperatures are not extremely hot. Although it's important to clarify whether a drop in estimated glomerular filtration rate over the course of a work shift represents a true kidney injury or it's a non-pathological physiological response, it's important to monitor the incidence of AKI among agricultural workers in Spain, given that we know that repeated episodes of AKI can lead to chronic kidney disease, and we also know that exposure to heat stress is expected to be more frequent among workers in the context of the current climate crisis. Well, thank you very much for your attention, and please feel free to contact me through email if you have any questions or you want any clarification regarding the study.